Today, we are more active than ever. We are more conscious of our health and know that a lifestyle that focuses on not just nutrition but exercise is key to a long and healthy life. However, there are times when that activity is stifled by chronic knee pain. If you think surgery may be the only answer, today we're going to learn about an investigational cartilage implant grown from a patient's own cells called NeoCart.
My name is George Pierce, and I'm in the commercial laundry equipment business and been doing it for 21 years. It's a very physical business where we sell and we're distributors for two major manufacturers of commercial laundry equipment, and so we deal in only industrial and commercial type equipment. We don't do residential, and it's all heavy, and for 21 years I've had to handle equipment and really have to get physical with it, and it's been hard on my body. I have a perfect balance of work and home life. I have two daughters, one in college, one a senior in high school, great wife, and lots of hobbies. I play guitar. I'm 44 years old. First sport I played was football. Played baseball from first grade through high school. Started playing tennis when I was about 7 years old. Started competing in tennis at about the age of 10 and played competitively until I was about 15 years old. It's always been a very important part of my life, and nowadays tennis serves as a way for me to let out some of my aggression. I beat up on a yellow ball instead of I get frustrated with anybody else in my life. I guess I'd consider myself a weekend warrior, but when I get on the court, I'm not just out there. I have fun, but I get very competitive, and I go to battle, and I become a Goliath, and I want to destroy when I'm on the court. Had about a 10-year hiatus, maybe even longer, where I didn't participate in many sports, and then started playing tennis again back in about 2010. And after that time away from tennis, my leg muscles weren't as strong, but my ability was still there. So I got back on the court, thinking I could play like I did when I was in my 20s and teens, but my body couldn't handle it. So immediately had a knee injury on my left knee and had microfracture, and recovered from it okay. And then back in 2014 started having trouble with my right knee, and injured it right here on my own court playing with my friend Dell. He's a trainer by trade, and he mentioned Dr. Jones to me and said that I needed to look into it because his specialty was cartilage regeneration and restoration. So when I went to Dr. Jones's office, waiting on Dr. Jones, I see a NeoCart brochure. So I pick up the NeoCart brochure and I read through it, and as soon as I finished reading it, I knew this is the surgery I need to have. I had a quick meeting with him. He went through all my MRIs and went through my x-ray, and after discussing with him for a while, he said, well, you were just looking at the NeoCart brochure, and there's a trial study. And so without going too much further, I just asked him, because I had read about Dr. Jones and saw that he played college soccer, and he's deals with elite athletes, which I'm not, but would like to know that the guy that's working on me really understands athletics and what it can do to your body. Dr. Jones was real clear on what I should expect from the surgery. I was back on my feet real quick. I was walking without assistance from a crutch. I was weight bearing at 4 weeks and off of crutches completely at about 9.
He was doing very well at 4 weeks after surgery, first of all. So he started, as he talked about, transitioning to one crutch at 4 weeks, advancing off them completely from one crutch to no crutches by 9 weeks.
It feels solid. It feels smooth, not only when I'm running, during motion, but just movement of my knee. I feel like I have it's glass smooth when I move my knee back and forth. My level of activity now, and has been for quite a few months, is back to what it was prior to my surgery. Except I feel stronger than I did before and more confident in my knee now. And I'm able to play competitively again. I am back to my warrior attitude, and my competitors have a little bit of fear when I get on the court nowadays.
If you're between the ages of 18 and 59, suffer from pain in one knee, and can provide informed consent, then this clinical trial may be right for you. For more information, go to neocartimplant.com or text knee9 to 87888 or call 504-267-1616. I'm Kim Alexis. Thanks for watching.